banquet halls are one thing, but if you can speak to the challenge of monitoring or enforcing behavior at private parties, if those events continue to be a concern, in people's own homes, what more can or will you do beyond education? And will the update that you alluded to from the Solicitor General include penalties around that?
I think it's an important question to deal with. We have, as you know, a history of respect for people's homes. A person's home is their castle, they used to say. I think some of that dates back to the Magna Carta, so we want to be respectful of that. And so to be effective across the system, we have to understand, and across communities, we all have to understand our obligations to one another. We have seen, and because public health reviews all the cases, that circumstances where people have essentially transmitted COVID-19 to one another in family circumstances with relatively small gatherings. So the importance of physical distancing and the importance of reaching out and convincing people of the need over a very significant time that lays ahead of us, the need to act in different ways is fundamentally important. It's important if you're 21, 31, 56, or 81. It's important for everybody. So that part of it, the convincing part, the asking everybody, but especially what I've been doing this weekend, asking people who can influence people from 20 to 40. And by the way, 20 to 40 may be seen as young, and from my point of view, I guess it is seen as young, but it's not young. And people, I think, and the people I've met on this weekend understand that and understand their obligation to one another and to their parents and to their grandparents and those that they know who, I don't know, might have diabetes or something and be even more vulnerable than they are. So the key part of our message, Tanya, is influencing and convincing, as it has been from the beginning, because to be most effective, you have to have that first. We all have to buy in, and overwhelmingly people in BC have bought in. And we can see that a little bit in these numbers. We have 4 people in hospital today with COVID-19, which is, by our standard, I think it may well be our lowest total since way back in March of people in hospital. So lots of good things are happening. So how do we deal with issues in home? Those are one of the things we're also looking at in addition to that, and in terms of the responsibilities people have. And that means that, and those are some of the issues that my colleague and all of a variety of ministries of government are taking a look at to communicate that message and to ensure that's come through. Now, Dr. Henry and the team of public health did make some changes with respect to short-term rentals that were relevant and have been relevant to outbreaks and will make, I think, a difference in the future. I think those changes came around July 23rd. And she and public health made a series of changes and limits to the number of people who can be invited in short-term rentals, for example, and houseboats and other changes that were, I think, significant changes at that time and that are helpful in enforcing that end of it. But the one place, you're quite right, that's the final challenge that we have to do some convincing but also look at to see if enforcement could be helpful in this regard is a private residence party hosted by the person who either rents or owns that residence. And it's a concern, and it's certainly something my colleague, the Solicitor General, is looking at.
Hi, Minister. I just wanted to follow up on Tanya's question there about enforcement. I know I'm jumping the gun here as well, but on the local level, when it comes to maybe beaches and parks and shopping streets and all of that, what might enforcement look like, and how would you sort of explain that tricky balance between, buying in, shaming somebody, and also enforcing it?
I think we have to recognize that the work of public health, and I'm going to ask Dr. Gustafson to speak to this because I think it's really important, that there will be no shaming of people who get sick, because we got to help them get better. And overwhelmingly, and I mean even in the last couple of weeks where there's been a significant number of cases, the willingness of people who test positive or who are required to go into isolation because their association with people who have tested positive, that cooperation is essential to stopping the spread. And that involves working with people and supporting them and helping them when they get sick. And that is the essential work that public health does. When we say we have 2,200 people under observation, those people are being worked with every single day by public health. And that part of stopping the spread and of enforcement, that is the most important thing we do. And it's extraordinary work being done by people in public health every day. And so all of those things are important. I think we have to understand and be precise about areas where we have vulnerabilities. And one of those areas, for example, is in the broad area of agriculture and food processing. And we've seen that with a series of relatively large outbreaks in food processing plants, and more recently in a blueberry processing plant in Abbotsford. And that requires a different kind of effort, just as our enormous effort in long-term care, where we focused in on those issues, required a different sort of effort. So I think we have to be precise here. The places where there's the greatest danger is our private parties where alcohol is involved, and it's inside. And I know that people see outside more than inside because it's outside. But those are the places where we have to communicate to people, don't hold private parties. Watch the Canucks with your bubble in the Stanley Cup run. We've got to communicate that message and find ways, should there be issues, to work with all of the people out there to both encourage people to follow the guidance of public health and to follow the rules of public health, but also, and that's really important, I think, but and provide on the business side of that some clear direction that should rules not be followed, that people are required to adhere to, that they be followed. So these are things we're working with, but maybe I could ask Dr. Gustafson to speak about the main issue.
Hi. So yes, with respect to helping people comply with the guidance that we have given, I think one of the things that we need to recognize is that we're all learning together. And we have some broad guidelines that public health has provided based on the characteristics of COVID-19, knowing how it's transmitted, knowing that transmission can occur more easily indoors and when you're in close proximity to people, and especially when you have symptoms or when you have been exposed to COVID-19 and you may be just before your symptoms. So we have given these guidelines over many, many weeks, where I think public health, the work of public health needs to continue and has been very strong, is working with people to apply these guidelines to their contexts, whether that's a school, a post-secondary institution, a small workplace of 20 people, or a large workplace or a business. The guidelines are actually simple, but when you are applying it to your place of work, your place of study, you will probably have questions. You will need support. And one of the areas where public health has been working very, very hard is providing institutions and services the guidance and the problem-solving day-to-day, as well as healthcare institutions, the day-to-day problem-solving of how do I make that happen and still function, and still make sure that I deliver the services that I need to deliver, or that I serve the people that I serve, or I create the product that I need to create. So at this time, we're 6 months into, or 9 months into this now, and or getting close to 9 months into this, and we are still learning together. But while absolutely regulations and enforcement have a role, as Minister Dix has suggested and indicated, there's also a great deal of influencing and learning together and helping each other through being able to follow those rules. And being able to follow those rules varies by your capacity, by your age, and doing the very best we can and learning as we go along. And I would like to speak a little bit about learning. One of the learnings we did was with respect to nightclubs and the types of regulations and recommendations that were put in place for restaurants and how those needed to be changed. And that's a really important learning that we did, and that to which we responded through guidelines and regulations.